Tinggi. Hello, I'm Dr. Maria, practicing integrative medicine in Pasadena, California. Today, we have another physician that you're very familiar with because Dr. Cynthia Shelby-Lane has been my guest when I discuss about COVID and vaccination update. Hi, Dr. Cynthia.
Hi, Dr. Maria.
Thank you again for updating this. And I'm sure we would like to say that we are not immunologists and we are not infectious disease specialists, but we follow the news of COVID and vaccine, and we would like to share with you. Now, today, the COVID and vaccine update is all about multiple strain that we have. And to tell you the truth, this strain we never expected when we started the pandemic. And we call it was like COVID-19 alpha and then beta, and then now is delta, there is gamma, lambda, kappa, name it. I think we will not be finished until we hit omega.
or zeta.
Yeah, zeta. We do not know when, but it's multiple strain. That's probably we have to explain a little difference between what is the difference between this with the original COVID-19. Well, to my observation, Dr. Cynthia, the difference is that the previous strain affected more on your upper respiratory tracts.
Right.
They have symptoms of cold and fever, dry cough, and then they keep coughing, and then, not wet cough, but then later on, when the new strain comes, everything seems to be faster, and you are missing some of these upper respiratory tract symptoms, and they suddenly have the lung appearance problem in their x-ray when they already have symptoms, and many of them have like 40% infection, and some of them experience gastrointestinal tract problems. Dr. Cynthia, I forgot to introduce who you are. You see, we appear so many times, so I thought
I know everybody knows. Nobody knows who I am.
Who is Dr. Cynthia Shelby-Lane? Okay, she's emergency medical physician, specialized in emergency medicine, but she's practicing integrative medicine or integrative anti-aging medicine and regenerative medicine. And she's practicing in Detroit, Michigan. Now, Dr. Cynthia has been a long years friend of mine, and we always laugh. You know why? Because for her to stay young and live longer, which is I agree, is laugh more and live healthier. That's
right.
for her. Why? Because she's a doctor by day and comedian by night. I love it.
Yeah. Thank you.
Okay. All right. So I would like to start with my first questions. Excuse me, I'm going to put a speaker view because sometimes I need to drink water as I have allergic for some reason to some of these fish skin, I think. Okay, one moment. So it's a speaker view. There you go. So Dr. Cynthia, why do people with COVID-19 get infected more than once? Maybe we should start with these questions.
Oh, okay. So I always like to start with a little bit of data. And so I'm just going to give you an update on COVID in the United States. And I know you do this worldwide, but to date, there have been 641,725 deaths in the United States. And 74.5% of adults have at least one vaccination. And COVID is on the rise. So your question is, why do people with COVID get infected more than once, correct?
Yes.
That's because the virus has mutated over time, and it's mutated since it was discovered in 2020. There was alpha, beta, and now we have this real dangerous variant called delta. And delta seems to be evading the upper respiratory tract and going straight into the GI tract and lungs, as you were mentioning when we first started. So people are getting a second infection or a reinfection, or maybe a breakthrough infection or an infection twice with COVID because maybe they had alpha, maybe they developed an immune system that was adequate for that. Maybe they got vaccinated, but now Delta is evading their whole immune system. And so you're seeing a different type of illness that's presenting on the horizon.
Yes, yes. So since we are every day we're talking about vaccinate, not vaccinate. So we do have the CDC guidelines for that for everyone to look at the CDC exemption or a recommendation, and you can also go to manufacturing site where they also have a list of that. But Dr. Cynthia, when they ask you, okay, why do people take is it okay to take drugs such as antipyretics before the vaccination?
So it's not recommended to take anything that's going to alter your ability for your immune system to respond to, which is an antigen, which is the vaccine. And even though people want to describe it as a vaccine versus not vaccine, this is something going into your body to help protect you from getting very ill from COVID. So the recommendation is do not take anything that's going to change your temperature or change your response. You want your body to do that. That's a reaction to what's coming in. And one of the reasons why you have a fever or temperature is because the body recognizes something is going on. It tries to protect it. Your temperature goes up. So do not take antipyretics or Tylenol or aspirin or anything like that prior to getting your vaccine.
I agree with you. For people who would like to, who wonder what's the preparation, we'll share with you later. But
Yes.
now, Dr. Cynthia, can we also talk about the side effect of the vaccination?
So there's Pfizer, there's Moderna, which are US based. There's also Johnson & Johnson. There are other vaccines on the market, but they are not promoted like those are. And most people are getting those, including 12 to 17-year-olds and 18-year-olds and above. So anybody 5 to 11 has not gotten the vaccine. So the vaccine can cause fever, chills, aches, muscle soreness. And actually, those are symptoms that you might think maybe I have COVID, but that's the body's reaction to a vaccine or substance coming into your body to prepare you so you won't get sick. So those are the usual responses that a body would have, a person would have, children as well as adults.
Yes. Last month, we do this every month, first Thursday of the month. Last month, we did mention a little bit about mandate. So let's go to cover about the mandate because school has started, okay? So back to school mandate, which is nationwide. And what are the guidelines? Can you please share with us after you reviewing all these mandate or vaccination?
Right, so mandates are the new word of the day. You must do something. Is it mandatory or is it mandated? The authorities are saying, we want you to get a vaccine and we want you can't come back to work without getting a vaccine, or you can't go to the theater without getting a vaccine. Those are like mandates. Is it mandatory? In some cases it is, in some cases it's not. What's with back to school, over 800 universities are saying you have to have a vaccine to come back, or every week you have to have a PCR test or a rapid test. You have to have a test. But what they're saying is you can't play sports, you can't come to our school, you can't do this unless you have a vaccine. So that's being mandated, not only in schools, like colleges, but also in the workplace. And that's pretty serious right now with respect to workplace. For instance, Delta Airlines, Delta, like the virus, Delta Airlines is charging their employees $200 a month if you don't get the vaccine. And if you don't get the vaccine at Delta, then you have to have a PCR test done. And that is because insurance companies are saying, well, we told you to get the vaccine. We're in charge of your insurance. If you don't get a vaccine, we're not going to pay your copay. If you get COVID, we're not going to pay anything for COVID-related illnesses. So here's a mandate. You must do this or else. It's almost like, think about this. You can wear your seatbelt or you get a ticket. All right. That's a mandate. You don't have to wear it. But if you don't wear it, you're going to get a ticket. So that's what's happening in workplaces, schools, institutions, and then back to school for children is even more scary to me because the parents are versus the parents, making the children against the children, And it's being governed, community by community, county by county, state by state. The governor, even the governor for the state of Michigan, which is where I am, is saying, I'm just going to let the communities hack it out. You're just going to go for it yourself. And so this is causing a lot of confusion, and people don't know what to do. So mandate versus mandatory. And just to bring this home, a big time comedian named Joe Rogan just got COVID, and he's completely anti-vaxxer. He doesn't think young people need to get the vaccine. He thinks they're healthy. He's a comedian, okay? So he came down with COVID, and he had a big guest appearance at Madison Square Garden, and he said that his audience members do not need the vaccine, that they don't need to be tested. Well, Madison Square Garden mandated that if you want to come to Madison Square Garden, then you have to have a vaccine. And so he gave the people their money back. So it's kind of interesting what the mandates are doing, from corporations to theaters to whomever. And if that's the way they're playing the game.
Mm-hmm.
And I'm not saying it's a game. I didn't mean to say that. I'm just saying that's the way it's unfolding. And it's kind of confusing because remember we talked about this before, children couldn't wait to get some children couldn't wait to get the vaccine because they wanted to play sports, they wanted to be with their friends, they're tired of being cooped up, they have stress, anxiety, they have fear. So when they go back to school, and then some kids are wearing masks because they're being told to. That's what my grandson was told, and some aren't, and then they're pitting kids against kids, and so a lot of stress, fear, and anxiety are happening because of mandates and mandatory.
For sure. Right now, the stress is building up because people, it's your example of seatbelt makes sense because the seatbelt put seatbelt on, meaning to protect you from when you have an accident. Hopefully
Right.
you don't die. Okay.
Yes.
Now that we understand. So you get and just in case you hit someone else. Okay.
Right.
So but the vaccine, the problem now is we want to tell them until we're black and blue, but the problem is make sure we know now that the vaccinated person and non-vaccinated person are not immune to any COVID
Right.
infection. So you
Absolutely.
yeah, that's the reason why people are so they use all kind of their anxiety and stress and whatever, it's not objective, and then they just still don't want to be vaccinated because of their previous experience or their premorbid or whatever they read. So they do not like it until when they announce that Pfizer is approved by the FDA. Now, oops, what is the next reason, right?
Yes. It was so Pfizer just got authorization through the FDA, and now that's for their vaccine to be approved, not emergency use authorization. The next category of people in the EUA, emergency use authorization, are 12 to 15-year-olds, and they're now EUA. And then the next group to be studied is 5 to 11. So this is just rolling out as you would have expected it to with, COVID. Here's a vaccine. And I understand people's anxiety. I understand what is going on with their fear, their mRNA. What's the research? Nobody really explained the research and then nobody really explained the research on mRNA prior to saying, here's a new vaccine, here's new technology. But the new technology has been in existence, been used for 40 years. So I don't think there was a very good explanation. I'm not going to explain it today. Maybe that's a future discussion, but that's what caused all this anxiety in the media and what you should do and what you shouldn't do. My biggest fear is people coming up to me real close, patients snatching their masks off and coughing on me. So that's still happening, and I don't appreciate it at all. And there was a huge study that just came out of Bangladesh. I think they had 340,000 people who were masked in Bangladesh. and 600 villages, and they put the mask on, and they did prove that the mask does help. It does work. So short of the vaccine and short of your fear, please wear your mask. Please stay 6 feet away. Please don't try to shake my hand. That's not acceptable. That's inappropriate behavior at this point in time. So there are things that do work that are just sanitation, sanitizing, being sanitary. Yeah. And that goes back to the 1900s. Washing your hands, just wash your hands, but don't try to touch everybody. So those are very useful things that we need to carry into the future as we go forward.
Yeah, that's a positive one that we learn from this pandemic.
Yes, absolutely.
We have to. Okay, now how about hand sanitizer? Does it help to, is it effective to prevent COVID-19?
So it won't prevent COVID-19, no. And number two, it will get rid of germs on your hands if it's 70% alcohol or more. Some things I've learned that I didn't know this about sanitizers, if they are more than 90 days old, the ability to maintain that 70% goes down. So you got to get rid of that old bottle that you've had there for a year, probably not effective, and then get a new bottle. Get the smaller ones, okay? But it does help to reduce the transmission. That's what it does.
Okay, let's talk about the breakthrough infection. I think it's very interesting. And what do you do if you have a breakthrough infection?
So breakthrough infections are usually people who had COVID, and they could have been vaccinated or unvaccinated. It doesn't make any difference. And then they develop COVID again. Most of the time, people who are developing COVID now, a second time, since I think June of this year, are usually, it could be earlier, those people are getting the Delta variant. And so it was different. Back in the day, it was Alpha. Now it's Delta. So maybe you had Alpha and Delta. And there are tests to look at the specific strain. I don't believe that doctors are actually doing a test to say, oh, you had Alpha, you had Delta. That's not what's happening.
I don't think so. Yeah.
No.
Nobody. In fact, there is still yet to see. I would love to see the report of the isolated corona, because I haven't seen it, not even once.
No. And I dig through literature every day. I'm like, show me some more stuff, because you want to be able to tell people what to do, and you want to know for yourself and your family as well.
Yeah, we don't even know we have the Delta, or we have the Lambda, or we have the what. All right. We don't know. So let me ask you, how soon can you get vaccinated after getting infected with COVID?
They're recommending that you wait at least 2 weeks, but generally 3 months, 2 to 3 months.
2 to 3 months. Yeah.
Because you do have some immunity once you get COVID. And so there's no need to and again, most people, when I asked them if they had COVID, did you see a pulmonologist? Did you see an infectious disease doctor? Who did you see? I saw my primary care doctor. Is your primary care doctor used to getting antibodies for COVID? Probably not. So they're following CDC guidelines, and those guidelines will say you can wait 2 to 3 months before you're getting vaccinated.
Yeah, luckily, I explained to my patients that if you have COVID-19, you have built an immunity to this vaccine, to this virus. So my is predictive health lab. I'm not advertising, but I use their lab to check the antibody, and they use the Abbott lab. So it is if their antibody is as high as, for example, 700 to 1,000, I tell them you can wait. Because you can wait. And then sure enough, some of them have very high result, like 13,000. I do not know if they do affect the dimer, because now I'm thinking of checking their dimer, because their IL-16 also went up. Now IL-16 is cardio related, not immune system IL, but I don't know. But maybe I will start checking on that one. So what about this? How are side effects of the vaccine? What are the side effects of the vaccines?
So the side effects can go from minimal to cardiac. They can go from fever, chills, muscle aches and pain. You feel like you have a bad case of the flu. And then there can be side effects that affect the heart, like pericarditis or myocarditis. But you can also get those side effects from having COVID. So you can get COVID and still have heart problems. I think the incidence of heart-related problems, and Dr. Sinatra, I love him, he would talk more about that than and know more about that than I would. But the problems related to COVID and the heart are greater than the vaccine and myocarditis. So it's relative, but they can be similar.
Okay. You know, when you have these vaccines and you are experiencing the symptoms from the vaccination, I'm not talking about the side effects. So how can you differentiate if a symptoms from the vaccine or the real side effects, where some of them they get their COVID infection within the first week or 2 weeks after the vaccination, where we actually expected that is the term of 2 weeks term is the side effect, not side effect, the symptoms of the vaccination.
Okay.
How do you differentiate that?
So that's probably symptoms, side effects of the vaccine versus having COVID. Is that what you're saying?
Yes.
Okay, so if you got the vaccine and then you're still sick, say for instance, you got the vaccine and then you develop COVID on top of that, you're going to develop some serious symptoms such as shortness of breath, difficulty breathing, probably fever. One way to differentiate it is if you're at home and you have these pieces of equipment at home, like a blood pressure cuff or a thermometer or pulse ox. If you are getting short of breath and you have a pulse ox that you put on your finger, and say I have nail polish, so it's going to be difficult to figure that out. But if your pulse ox level goes below 95 and you're having shortness of breath, you may be having problems related to a reinfection with COVID, not necessarily the vaccine. If your pulse ox is less than 95 and you're getting sicker and sicker, you need to go to the hospital. And it's I think probably know your body. Even the comedian who Joe Rogan, he said, I just feel awful. I feel like hit the wall. I just feel really bad. But one way to measure that at home is to have a pulse ox at home.
Did you say your friend actually survived?
He's not my friend. He's a comedian.
Oh.
He's a big comedian. I'm a little baby comedian.
Did he survive?
Yeah, he survived. And you know what he did? He did something controversial that you and I always talk about. He took ivermectin.
Mm-hmm. Yeah,
so that's hitting the airwaves pretty today, tomorrow, the next, because ivermectin is really out there right now, and people are using it properly and improperly. So he had access to ivermectin, and he says he feels better now.
Yes. Okay. Thank you so much. What about what actually constitute a legitimate reason to refuse the vaccine?
Legitimate reason. Good question. Probably religious reasons. Probably you had.
No, they don't accept that anymore.
Okay. Well, those are slowly fading out. So you've had to have had probably not allergies, but an allergic reaction, and that says I can't take these types of vaccines. I've had an allergic. Maybe you had a vaccine before. Maybe you had your first COVID vaccine, and you had an allergic reaction. You don't want to get another vaccine.
Yeah, you don't want to proceed. Yeah, I have a patient who had that. A few of them actually, not only one. And I said, just stop. Don't use that. Don't continue. Yeah. Right. And they already got their passport, so that's okay. What's the best way to prepare your body to get this vaccine to reduce the side effects?
I always tell patients vitamin D, up your dose. It's 5,000 to 10,000. Make sure you're doing that on a consistent basis. Don't say I did it one day and now go get the vaccine. Give your body a week to 2 weeks or a month. You should be taking it anyway, vitamin D. Proper sleep. You need 8 hours of sleep, like 3 or 4 days prior to that. Exercise is always good. nutrition, good nutrition and good nutrients. And I'll talk about that in just a moment. Having a good gut health. There's vitamin D, zinc, 50 milligrams, vitamin C. Quercetin is great for anti-inflammation. So not something like Tylenol. And curcumin, melatonin for sleep, green
Some
tea.
people take the
Vitamin E,
yeah.
absolutely.
Yes.
And N-acetylcysteine is also good, which is like glutathione or precursor to that.
Yes.
And the other, I have a list here at berberine also. Berberine is very good for the inflammation. And people who have premorbid problems are really at risk for COVID. So I had a patient who she got really sick. She was pregnant and her blood pressure wouldn't stay down. And her doctor, GYN, couldn't keep it down. She went in the hospital 7 months. She had to deliver via C-section. She was on a ventilator. She has long haul syndrome and she's very, very sick now. So, and she hasn't gotten the vaccine.
Did she get COVID or did she get
COVID
vaccination?
Yeah.
Oh, was
COVID.
she vaccinated or non-vaccinated?
No. That was it
Because of the pregnancy. Okay.
Yeah, she wasn't. So.
Okay. All right. Well, we approaching the limit here. And what is the best way to prepare your body? Always back to the prevention now. Maybe you can give us the take-home message, and then you can give us make us understand how to prevent and what pre-existing condition needs better management with compliance and traditional therapies. So that's our field.
Right. So COVID-19 has opened our eyes to things that have been going on for a long time in health and healthcare, which is that premorbid state, which led to metabolic problems in our body, which nobody was addressing except for with pills. And so if you have somebody with hypertension or diabetes or cardiovascular disease or immunity or obesity, if you have less access to good care, meaning I can't get to a doctor, I don't have insurance, I only go to the emergency room when I get sick, you are going to be in a state where you're always going to keep getting sick from anything that comes up. So what you want to do is the things we already talked about: good diet, exercise, sleep, meditation. I'm doing a totally new meditation course. I'm so excited about meditation and getting my brain to just let thoughts come in, stop filtering everything out, and just calm down, because I have a hyper excitable brain like you do.
So, do you laugh when you do that?
With meditation, I just listen to the sounds, the refrigerator, the dripping, the pipes, the birds outside. And those things come in. And then when the thoughts come in, I like, it's okay for them to come in, just don't address them. So quieting our bodies down, getting in a meditative state, like an alpha state, is incredible. And I think people need to really understand, what longevity means. You have to do a lot of things to always prevent. Exercise, walk. I'm doing weightlifting now. Well, me and weightlifting. I'm doing my Peloton. My Peloton bike. I take all the nutritionals, and I think your audience understands what they need to do, but you got to do it consistently. Correct. Don't stop. And I think for me, and probably for a lot of people, because of the anxiety, I'm just so anxious every day about people around me. Trying to get to sleep and getting to sleep is really important. Sleep is really important.
Yes. Okay. I have one more question from the audience. I hope you don't mind. I know 30 minutes. Colleen asks, what exactly does stress do to the body? That's a good question.
It is. So it changes your hormones.
Yes.
It changes your hormones. And I'm talking about the hormones of fight and flight. And so cortisol. And so when it changes your hormones, that increases inflammation. When it increases inflammation, then the body can't react normally. So the immune system's in a hyper state. And therefore, when a COVID type of thing comes into your body, anything invades your body can't react normally. It can't prepare it. It's not prepared to fight. it's always in fight or flight. But when your cortisol levels are low or high, for instance, I was pretty low in flatline. You have to do things to change that. And there are nutritionals that help that: sleep, meditation, prayer, mindfulness. But those stress hormones can really be dangerous in terms of your long-term health.
Well, she asked one more question. Do
Okay.
you do earthing, Sinatra?
Oh, absolutely. I'm barefoot right now. You want to see my feet?
We have to. Yes, Dr. Sinatra's earthing is very helpful.
Yes.
Everyone should do earthing.
Yeah.
Right? Yes. Okay. Is there any more tips? If not, I will really meet you next month.
Yes.
Yes.
Hopefully. Yeah.
Okay.
Taking off.
Yes. What's the big thing happening with you recently?
Recently, recently I applied to be an astronaut, and I am in possibly, I'm just going to keep my fingers crossed, going to make it as a finalist to go to the International Space Station.
We pray for you.
Yeah.
Who are in that uniform. Okay.
That's right.
I'll see you soon.
Floating around weightless.
Wow. Thank you so much, Cynthia.
Thank you, Dr. Maria.
Yeah, from Detroit, Michigan, and she's an integrative anti-aging medicine with regenerative medicine. And I am Dr. Maria Solindro, practicing the same integrative anti-aging medicine and regenerative medicine from Pasadena, California. See you next month.
Bye-bye.
Bye.